Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. As we transition from ACO REACH to the Medicare Shared Savings Program in 2025, our ACO is entering new territory with new metrics and new opportunities. In this episode, we explore how the lessons from ACO REACH can guide us moving forward and what health center leaders can do to navigate this shift.
We've been discussing our performance in ACO REACH for 2024, and as an ACO, we're leaving ACO REACH and we're shifting into Medicare Shared Savings Program, MSSP, for 2025, and that's new to us and to our health centers, and with that, some new goals, some new quality metrics. How can we apply what we've learned in ACO REACH to MSSP?
In the previous episode, Kim mentioned that quality measures are harder. They're different. If I look at it as a clinician's perspective, they are the most simplest quality measures, because if you look at the quality measures for MSSP, they are hypertension control, diabetes control, breast cancer screening, colon cancer screening, to talk about the most important ones. And that is what means managing chronic conditions and preventing cancer, whether it is breast cancer or colon cancer, which are two of the important screening measures in the quality measures. So if you take care of your patient's chronic conditions, if you screen them for their cancers, that is all that we need to do for MSSP. And if you are doing that right for every single patient, you are definitely going to meet the goal for the quality measures. The ultimate goal for these quality measures is still the same, value-based care, which was for the ACO REACH also. You are making sure that their chronic conditions are getting better. So you're managing their diabetes better. You're trying to make sure their blood pressure is better controlled, and making sure they're getting their mammograms or colonoscopies or Cologuards, whatever the case may be, and thereby preventing any acute episodes related to those screenings not being done.
Correct me if I'm wrong. Are these metrics for MSSP really similar to the Medicaid ones?
Yes, they're very similar, and so I think that in itself provides an opportunity for health centers who are contracted on both sides of business. There's initiatives that you can do that'll work for both populations, and in turn you'll meet both quality metrics, and so that's even more cost share saving opportunity there. And so I think that's Dr. Siri said it best, is right now the focus needs to be on disease progression, and so making sure that you are managing those chronic conditions instead of just focusing on those acute events, and that works for both sides, Medicare and Medicaid. And so that's the nice thing about this, is that I think you'll have similar teams working on both efforts, and so you can kind of almost double dip, where it's not necessary to bring on new team members. You just have to kind of shift perspective to work for both sides.
Yeah, it might be simpler for FQHCs this year with the MSSP program, because they'll look at, we are doing this on Medicaid side already. Now we do not have to think about our Medicare populations as different, because the quality measures look like they are the same. So the same efforts we are putting on Medicaid side can be offered to Medicare patients, and lo and behold, we are meeting our quality measures.
Mm-hmm. And I think that's one of the things I was early on, just talking with Tony, our CEO, was there certain campaigns that we can do. Like, for example, there's hypertension control on both sides, Medicaid and Medicare, and there's population-wide campaigns that we can launch for our FQHCs that'll first already retain that population we have, but re-engage new ones, and that'll increase in turn our population, which only helps us. And so that applies for adults who are 30, 40s, to our Medicare population, 60s, 70s, and that works for everyone. And it's the same group that is still working on it. Our care managers, our CHWs, our providers, again, still that multidisciplinary team, but now they're able to focus on a wider population and cast that net a little broader. And that in turn gives us that stickiness, that retention that we need to ensure that we keep our population who's already attributed to us, but also attract those new ones, because they'll see well, this FQHC offers a hypertension program and they've proven success. I know my neighbor Betty, who, now she has it under control and she seems to be so much happier and she has a doctor who listens to her. Now let me go visit that doctor as well. Give us that increased population that we need, to see higher potential financial return.
Word of mouth.
There's a lot of things that we can leverage, kind of tying into what we said earlier. There's a lot of technological aspects where we can do digital campaigns that reach a broader net than, having those in-person health fair clinics, things like that. And those are opportunities that we can maximize on coming into this new year. I had a conversation earlier with one of our FQHCs. There was a campaign that I think it was Banner who did it, and it was like, when do you visit an ED versus an urgent care? And it was like, I got stung by a bee versus I stepped on a beehive. And it's like those little graphics, those little bite-sized pieces that get the message across but are so much easier to digest for the patient. I think that will truly be effective.
I think, my next question we kind of already started talking about with this new program, some new challenges, but that out-of-the-box thinking and how we can partner with our health centers. Are there any other suggestions that you have for health center leaders about how they can maximize their opportunities moving into this new program?
I think for the leaders, I have one suggestion is to make sure that they are promoting teamwork. They have to make sure that their staff is working in teams, and they should also meet with them regularly to see what are the challenges they are facing and how is it that they can be resolved. Because sometimes if the staff does not get that guidance from their leaders, it can make them feel discouraged or not very interested in doing what they are doing. So I think that guiding light should be there, that frequent meetings to encourage them and support them in the right way should be there from the leaders.
Yeah, and that's a good point. Like every health center, every business is different. They have different unique peoples within that organization that have unique challenges, and having those conversations, the teamwork and the communication.
And I think with adding on to that is one of the evaluations that we did at the end of 2024 was to analyze the internal infrastructure and workflows that each FQHC had, and in turn, what was the impact with their population. And so with that, one of the key reinforcements that we said was you have to have standardized protocols when it comes to how you outreach, how you follow up, how you do care transitions, how you work outside of the four walls of your FQHC. And once we had that conversation with the FQHCs, we were able to see that it was much easier for them to operate with, different populations, different groups. And so it's looking at internally, what can they do to strengthen their internal workflows and the collaboration between their different teams. Like we said in the previous episode, not working in those silos, making sure that, there is that communication, whether it's pre-visit planning, the care team huddles, or, doing more risk stratification based interventions. You have to make sure that you're being proactive, not reactive. And that's where leadership can really come in with having those conversations and making sure that everyone's on the same page.
You have to lead them. You have to be the guiding light. You have to make sure you are involved with whatever is going on in your health center. If you do not give that guidance or you don't lead them, then things fall apart.
And I think that's one of the things that at our kickoff conference that we had earlier this year, it was nice to see that we had so many members there who were committed to the value-based care initiative, and they were invested and they truly believed in it. And I think once you see that somebody's a champion for it, you want to get behind them. And that's the nice thing that we have, is that I think I can say all the CEOs at our FQHCs truly do stand behind this idea. So it's easier for that to trickle down into the team. And trust me, the beneficiary themselves will see it. They know the difference between a genuine phone call or just somebody who's trying to fill a task for the day. And that's the difference, is we need to make sure that we truly do believe in this idea. And that starts, like Dr. Siri said, at leadership, having that coach to guide the team, and then the team will follow right behind and rally.
I think it's important to reiterate, we've already talked about this, but the health centers have a partner in what they're doing. And the stronger we stand together, the better we are able to support them in the efforts that we're asking them, it would just feel like, oh my gosh, overwhelming, right? So that partnership that the ACO has with the health centers, we have your back.
That's that partnership there, and that's what I think really works when you have an ACO, is it's not just us alone. There's 6 other FQHCs in this network, and they're all working the same goal. So why don't we all contribute and talk to each other and see what the best practices are? How do we make sure that we improve our time, in that relay race? Let's get faster and faster each year. And that only works when we keep an open channel communication amongst all of us.
I always say stand together, fall together.
Yeah. And that's, and that's what's true, is you can't have an individualistic mindset in an ACO. You have to make sure that you are collaborating and there is that agreement. And I think that's one of the things that did excite me this year was, we were able to have an open discussion at our conference where everybody was, kind of riffing ideas off of each other. We were all talking about initiatives and campaigns, and I think if we carry those out this year and we continue those collaborations, we'll see success, because we have to make sure that all of us are winning. And
you made a good point here, Kim. The CEOs or the leaders have to realize that it is a shared responsibility. You cannot assume that if the other FQHC is doing well, you'll be okay. No, you have to make your effort, and you have to make sure your FQHC is performing better too. Taking the right steps to make things right on your side too. Otherwise, if one big FQHC fails, others are pulled into that, even though the other FQHC was doing well. So it's important to realize that we are all equally responsible, and we have to take that step towards making the right decision.
Yeah, and you mentioned silos earlier, and I think it's important to recognize that the health centers don't silo themselves, and to be open to that collaboration, because what's working with one health center,
the best practices,
that might work with another health center. They had that same barrier, or, to get them talking amongst each other. And that, the conference last year, that was one thing that we kept hearing. It's so nice to have this collaboration and hear what they struggled with and how they fixed it, and how we can take that and apply it.
And I think that's one of the things that we're excited, this year we're doing an innovations committee. And part of that committee is to have those discussions amongst ourselves and also with others outside of our network. Because, we may not know the best answer, but, somebody on the East Coast may have already figured it out, and there's no need to reinvent the wheel. And there's things like that where it works better to have all of us talking to each other and working to solve the same issue, than individually. And I think that's one of the things that I'm excited to hopefully see take off this year, because as Dr. Siri said, we were already on the right track. We see that, upward traction. Now we just need to make sure it continues, especially with the new goals and quality measures set for MSSP.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.